So my name's Allison Kilcoyne. I'm a family nurse practitioner, as you know, by trade. Been most of my career in school-based health, and I have a new position at our federally qualified health center north of Boston as the Vice President of Integration, Wellness, and Community Development. And I'm going to be talking today about creating and sustaining collaborative relationships with school communities. So we're really going to talk about ways to engage school community personnel in championing school-based healthcare, identify ways to build trust with stakeholders, and then at the end, I'm going to try to make sense of how this worked real time by a case study of from a process that I was involved in one of our school-based health centers. And so some of you may have seen this infographic from the School-Based Health Alliance, looking at what are the pieces that make a successful school-based health center. You know, we've got both a sound business model, we've got high quality practice, and what we're going to talk about is strong partnerships. And the partnerships that you make in the school, they really create the opportunities to provide excellent care for our youth. So what we're really focusing today on the school, but a lot of the things we're talking about can translate into how you make relationships with community partners, partners at your agency, and everything, students and even families. So I am a big believer in starting with the why. Some of you may know Simon Sinek. He's on social media a lot about his golden circle, and like starting with the why is really looking at what is the purpose of the work that we're doing. And some people look at this as a mission, as a personal mission, but whenever I've found that I've had to deal with some conflict or troubles in schools, if I go back to my why, it makes the conflict easier to manage. Then move to the how and setting up the process, and then the what and the outputs, right? And to get to the outcomes that you like. A lot of people want to kind of create the what. So let's figure out this alternative to suspension program. Let's figure out a workflow of how to get students to the health center. Let's figure out how to do SBIRT, instead of really looking at why do we want to do this, and shifting minds to buy into the why. And then I think the process of collaboration moves easier. So I have a why, and my why that I always go to is that I believe that youth deserve access to all the services they need in order to thrive, and that school-based health centers create that access in a high quality, efficient, safe, and youth-focused way. So whenever I am approaching a new partner or a partner I've worked with for a while, I always start with that this is a core belief of mine, and I want to find partners that actually either share that belief or a similar belief so we can partner and move forward. And then you collaborate on the how, right? So then you start to communicate when you can find people to come into the why. We want youth to have access to all the services they need to thrive, or we want youth to have the best access to their education that they can. Then you start to talk about how do you get that message out? How do you find people that have the shared values? Do you know what your values are? You know, for me, it's equity, collaboration, flexibility, right? And so what I know is when I'm in conflict with someone, usually it's one of those values that maybe we aren't seeing eye to eye on, so we have to talk that through. I think partners in schools may not be who you think they should be. Many of you are working in schools, so you understand that walking into a school sometimes can be like walking into another country. It has a different hierarchy. There are different rules and regulations. There's always champions that you may not think. You may think it's the principal, but maybe you need to find that health teacher that's been there for 30 years that the principal will listen to, and find the champions that way. So another thought of the how. Get those champions together. Do you do a work group? Do you join? Do you put yourself out there and say, oh, you have a health advisory committee? I'm happy to sit on that committee for you. Oh, you need help working on, you know, a protocol for emergencies? I'm happy to help. How can I help? We are experts in school-based health centers in health, in behavioral health, but a lot of times educators need that expertise. So how can we help them? I do, in my experience in school-based health centers, recognize that we are not there to solve the problems of the school and the educational system. We sit at the intersection of the two most difficult, challenging systems, the health system and the education system in the country. We can't fix all the problems, but we can listen, we can take notes, we can follow up, and know that it's not a quick fix, right? If we jump into, I know how to fix your problem, sometimes people can not want to collaborate and work with you, and that we're really cultivating long-term relationships with our school partners. So I found this definition of trust, and I think developing a trusting relationships with our school partners is probably the most important thing that we do, and that is what will drive getting the other things done, right? Like students walking in the door. Something as simple as getting students to walk in the door starts with relationships. And so I like this quote, trust is choosing to make something important to you vulnerable to someone else, right? Like that you're putting out there what is important to you, and you may have to compromise, be flexible on it. I'm also a very big Brené Brown fan, and so if you haven't read some of her books, I highly recommend them. Rising Strong is good. Dare to Lead is my favorite. But she has, and if you can Google Anatomy of Trust on YouTube, she has a great 10-minute talk just about what this is braving, and that how we develop trusting relationships with others is that we go through this process of boundaries, right? What's your role? What's my role? Let's stick to it. Let's be really clear, right? Think about that in your school-based health center versus your school nurse versus in co-located in a school. Reliability, really being there when you say you're going to be there and telling someone when you're not, right? Accountability, owning when you mess up, right? I've messed up many times, as we all have, and just owning it and saying I made a mistake. How do we repair it? Let's move forward. The vault is something more, around holding information that's sacred. So someone in the school building tells you something about whatever, that you don't share what's not yours to share, and you don't comment on what's not yours to comment. And I think I look at that as professionalism in the school. Integrity, non-judgment, right? School teachers are having a hard time getting their curriculum done. I don't judge them when they say, no, your student can't come down. I try to figure out how do we work together to make this happen? And then generosity. And really that trust is built in very small moments. If you can walk down the hallway and a teacher comes out to you and says, can you watch my classroom for a minute? I just really have to go to the bathroom. And you stand in the classroom for 3 minutes. That is building trust, as that you are a partner in the building. And people are more willing to kind of work with you on different things. And then moving to the what, right? So I pulled some of this information from some of your assessments. So then you move into the development and the implementation of health policies, right? If we start with that, we're not getting the buy-in and we're not developing relationships with our partners. And that's when it gets difficult. And so sometimes when you're trying to institute a policy, a protocol, if you take a moment and take a step back and say, why isn't this working? It really has to go back to how you started the process. Why are we doing this? Do we all have buy-in? Okay. How did we come up with the protocol or the process? Did I just think that this is what's worked for me in another school district? Or did I think that you're doing this wrong? I think you should do it this way, right? So just taking some moments to take a step back. I know that collaborating with educators on how students access the health center is a challenge for any school-based health center. I've seen them from across the country. I've worked in many, and focus on time and learning, and you can't come out of the classroom for that long. What has worked is going back to the key stakeholders and saying, why are we here? Right? We're here to provide access to vulnerable youth to services to help them be healthy and help them better access their education. So when they're in the seat, they're actually learning. So how do we work on that together, recognizing that your view as an educator is, well, I need the student in the seat and in the classroom. And my view as a medical provider is, but if they have an infection in their eye and they can't see the board, what's the point of them being in the classroom? Or if they have untreated behavioral health issues, are you getting that quality education? And so looking at the problem from that perspective, I think sometimes helps. Conflict can come when the values aren't aligned. So taking a step back, I had a principal once that just, I couldn't get along with them, and we'd try and we just were in conflict. And when I realized that he just wasn't a collaborator, collaboration wasn't one of his values. His value was the outcome of getting things done in any way, shape. So we were in conflict. And once we figured that out together, we could move forward, but not until then, because we were just butting heads. It was a values issue, not a person issue, right? And then bringing it always back to the why. So I thought the way to put this together, because I do recognize I am not giving you a prescription on how to write a protocol on community engagement or a way in which to do it. I'm really asking you to think about it in the terms of relationships, because that's my belief is how we move anything forward in health and education. I wanted to talk about an experience that I had as the program manager and nurse practitioner at a school-based health center that I helped open in 2015. And so what happened in May in 2016, the superintendent, who had had his own personal story about substance use disorder and people in his family, wanted a substance use disorder provider in the school-based health center and wanted a diversion to suspension program. That was the superintendent. And so we said, okay, found some grant money, put out a job description. And then we hired an LICSW that had done this program in other districts, a diversion to suspension program. Part of it had education to parents, education to teachers and guidance counselors, and that the thought was, we're going to bring her in and she's going to replicate this program from another district into our high school. And so her criteria was that students caught intoxicated or in possession of substances or paraphernalia, either in school or at school events, will be diverted to the program. So in October of the year, right, she hit the ground running. We had meetings, we had educational meetings, we recorded it, we put it out to parents, and she really worked to the deans of students who were in charge of the disciplinary actions in this school, what the requirements were for referral. Had the referral form, had, the process was written, and we gave it to them, and we said, this is how we're going to do it, and this works someplace else. So from 2016 to 2017 school year, we got 5 referrals. I think there were probably over 100 actions, again, with students that had either been intoxicated or brought paraphernalia into school. They were still out of school suspension, and we had 5 referrals. So then 2017, 18, we continued to do the same thing. We couldn't figure out what was going on. We had this great program. We were educating people. We were telling them, we were, got no referrals in the whole year. But the behavioral health referrals kept coming. So she started to just, she's also a LICSW, started to do behavioral health referrals for the 2017-2018 school year. So then the next school year, 2018-19, we stopped the program because we were getting no referrals, and we were putting a lot of time and effort into educating people, and they weren't following the process that we had developed. And then what happened in the fall of 2019, there was, if you remember, before COVID, I know it wasn't that long ago, but it seems like it was a long time ago, we had a vaping crisis. And the deans of students came to us and said, can you help us? We can't keep up. We can't keep up with the disciplinary actions. We're chasing kids around all the time. What do you think this means? How do we help these kids? And I was like, okay. Youth need access to services that they need in order to thrive. That's where we started. Within 1 month, we created and launched a diversion program for vaping nicotine. The school district said, we have a problem with vaping nicotine. We do not believe that marijuana fits into that category. We do not believe that using other substances fits into that category. We only want this for nicotine. And we said, okay. We worked together and we developed a protocol. We worked together and developed the program, how it was going to be set up, who was going to be referred. So between October and March of 2020, we got 34 referrals to the diversion program. And 15 of those were for vaping marijuana, because they started to say, oh, these students are also having a problem. They would benefit from this educational process. And then out of that, we were able to identify 10 students that were interested in nicotine replacement therapy. So the team in the school-based health center was able to internally set up that process, right? And so I think what that tells us is that it's not all, we could have a perfect process and policy and protocol, but if you don't bring the humans and the people along to buy in and to really collaborate and work with you, it doesn't matter. It doesn't matter. It doesn't work because we're humans. And so I was writing up this this presentation on this week, and a colleague of mine sent me this meme in my email, and so on my phone, and I wanted to share it with you, from Colin Powell, because I look at what we do in school-based health as leadership, and that leadership is all about people, and it's not about organizations, it's not about plans, it's not about strategies, it's about people motivating people to get the job done. And that you have to be people-centered. And I think in school-based health, we are very youth-centered. That's why it works. We are meeting kids where they're at to give them the services they need to thrive. We have to take that same approach with the adults in the youth's lives, the educators, the community leaders, the parents. We have to meet them where they're at in order to move some of these policies and processes forward. And we may have to compromise some things, and that's all okay. Because if you really focus on what is the best for the youth and why you're there, I think that you can get a lot done.